Welcome to the video supplemented instruction of the clinical skill central venous catheter insertion. My name is Doug Hardikoff and I'm a senior SRNA at Baylor College of Medicine. First, please take a moment to pause the video and read through the objectives. Start by gathering your supplies. This includes a central line kit, sterile gown, and sterile gloves. Now, place the patient in Trendelenburg to engorge the veins of the neck, and turn the head to the left. Find the sternocleidomastoid muscle and identify the sternal head and clavicular head. Between these two is where you'll find the right internal jugular vein. Look here with ultrasound before draping the patient. The internal jugular vein, indicated by the blue arrow, should be superficial and lateral to the common carotid artery, indicated by the red arrow. By pressing the ultrasound probe against the neck, you'll see the internal jugular vein compresses while the carotid artery pulsates. Scan up and down the neck to check for bifurcations and thromboses. Once satisfied with your target, begin to prep the patient's neck with a prep stick, ensuring a wide area of coverage. While the patient's neck dries, open the central line kit. Then, scrub and don your sterile gown and gloves. Now that the patient's neck is dry, drape the patient with the fenestrated drape. You may want an assistant to help pull the drape towards the feet. Now, apply the sterile ultrasound probe cover and make sure any air bubbles in the gel over the probe are removed, as this will hinder your view. Extra sterile gel can be put on the sterile field. Now is a good time to set up your equipment in the order you will use it. Your finder needle, your guide wire, a scalpel, the dilator, the central venous catheter, sterile flushes, and sutures. Now, place the ultrasound back on the patient's neck to find the target and grab the finder needle. Guide the finder needle with the ultrasound into the right IJ, drawing back on this syringe the entire time. Once in the right IJ, blood will aspirate into the syringe. Now, stabilize the needle and remove the syringe. Thread the guide wire through the finder needle. Only keep feeding it if it passes easily. Do not force it. You do not need to feed the entire wire, only enough to get into the vein. Remove the needle, but leave the wire in the vein. Advance the wire to 20 centimeters at the skin, but watch the monitor for ectopy, and then confirm the wire location with ultrasound. Unfortunately, the wire does not thread easily through the material of this mannequin. Now confident you're in the right IJ, insert a scalpel into the puncture site. The sharp edge of the blade should face away from the wire towards the chest. The incision should be large enough for the dilator to fit through. Feed the dilator over the wire. With firm, steady pressure and a twisting motion, dilate the skin and subcutaneous tissue with the dilator, creating a tract. The dilator only needs to get to the outer edge of the vein. Avoid kinking the wire, and once finished, withdraw the dilator. Pick up the central line, feed it over the guide wire, and begin to advance it into the skin. Once the guide wire emerges out the back end of the CVC, grab but don't pull the guide wire. While holding the guide wire, advance the catheter through the skin. Once in place, remove the guide wire while holding the CVC. Aspirate blood from and flush all ports. Once satisfied with the placement, Suture the CVC in place and cover with a sterile tegaderm. Thanks for watching, and good luck with your central lines.